So, good afternoon. Very, very warm welcome to this masterclass. Are you all enjoying ACE so far? How's it going? Excellent. So I'm Paul Huttra, the owner, chief executive of Schuco, tomorrow's skin technology. Delighted to introduce the expertise of Dr. Rita Rakus, Dr. Nyla, Kambiz Golchin, Mr. Kambiz Golchin, Garrett, very ably assisted by Shirley Nickel. And without further ado, I'm going to hand over to Dr. Rita, who's going to share some of her experiences using Princess fillers. Thank you.
Well, it's a great honour to be here today, and welcome everyone. Now, everyone who's watching the demonstrations in the back, maybe come up a bit closer and have a seat even on the floor, so we don't want anyone fainting with some of the injections later. So I've been using Princess filler now for about 5 years. I was the first practitioner to use it in the UK. I have been injecting since the early 90s, and I think as a Princess they've made 45 million syringes. I haven't injected quite that many, probably about 140,000 syringes. I've been used many of the major brands over the years and been involved with pioneering them. About 6 years ago, I was first introduced to Princess filler by one of my colleagues who regularly introduces me to various major practices around the world. And I was taken over to Vienna in Austria and saw the factory and was very impressed. Princess has been around for a long time. It's made by Chroma Pharmaceuticals, and they originally made hyaluronic for the eyes, so it's very pure hyaluronic gel. And that's what I do find. As you know, I've got this title, the London Lip Queen. And so for me personally, it's very important to have an injectable where there's minimal swelling and also minimal late onset complications, for example, swelling or lumps 2 or 3 months down the track. So this is why Princess particularly appealed to me. I've been using it, as I said, now for about the last 4 years, and I'm very, very happy with the results. Recently, Mr. Golchin and I went over to the factory, and Karen's told me I've got to tell this story. We went over to their new factory where they now make 20 million syringes a year. And it's still a family-owned company, so it's very individual. You get very good individual support. The father who started the company was telling us how like a lot of us that started off, he used to go to the post office and post the first syringes to their different clients. He was also there at the factory and took Mr. Golchin and I on their new forklift around the factory. Unfortunately, this forklift is pretty snazzy. You know, it goes up about, 6 stories? And I was screaming on this machine, but we got a serious tour of this beautiful factory. And as I said, Garrett is now using Princess as well, and he's going to be here as I'm the lip queen, he's going to be the lip prince today, showing his expertise. And we've got Dr. Nyla here, and she was introduced as well. So once I got my hands on Princess, I couldn't help but spread the news because it is a very, very good product. So with no further ado, I will hand over to Lee to start injecting lips.
Thanks, Rita. Thanks for that introduction. So hello, everybody. I'm going to introduce my model. Her name's Odette. She's a 48-year-old lady, and she's got early signs of aging going on. As you can see, she's got a sort of elongation in her upper lip. She has volume loss around pre-gel sulcus, and she's got some deterioration in her lips as well, so she's losing some of her red border. So what we're going to do today is we're going to go in and use a cannula to help and support her GK, sort of like the ski slope, and to pick that up to try and shorten the distance from her nose to the border of her lip. Because of time today, I'm not going to be able to demonstrate the chin and the pre-gel sulcus, but we'll see how we get on, and that's it. Okay. So the product of choice, I'm going to use the Princess filler with a cannula, 25 gauge cannula.
Afternoon, everybody. I'm Dr. Nyla. I'm just going to be supporting Lee in the background and providing some commentary. I can take some of your questions, or I can ask Lee some of my own questions.
Scratch, okay.
So, Lee, do you mind us talking to you now?
Sure, not at all.
So, one of the questions I want to ask you is, how long have you been using Princess Filler?
I've been using Princess Filler now for 6 months.
Okay, and what made you kind of swap to what was you using before?
I was using the Juvederm products.
Which ones?
I was using Verbella and Volift. But I decided that I wanted to use a product that was a bit more pure and didn't give me any sort of complications.
Okay.
So I'm just inserting my cannula just into the vermilion border.
And how do you feel, Lee, how does the extrusion force compare to, say, I don't know, Volbella or...
The extrusion forces, I would say, is pretty much the same, but what I like is the glass syringe.
Yeah. And why does that make a difference to your practice?
I think it's to do with sort of cross-contamination, and I'm always concerned about plastic, and we're never 100% sure what's going to come out of this plastic thing that's going on at the moment.
Okay. So what volume have you just injected into that?
So I've gone up to 0.3.
God, that's pretty dramatic, isn't it? If you can see, guys, from the lift, just with 0.3 mils.
So we've got 23% hyaluronic acid in Princess Filler.
Yeah. Very minimal swelling as well. Looks...
Can I have a little bit more light there? Just a little scratch there.
So, Lee, what are the main differences that you've seen compared to other products? Just in the application of the product?
Well, the application of the product, it's for me, it's post procedure. It's the it's no complication. It's no swelling, and I think it's what I like is when the patient comes back after 4 weeks.
Yeah.
Is they just look fantastic, and there's no bumps, lumps. It's a very natural.
Sorry, so you see them after 4 weeks? So it's not like 2 weeks normally we do?
No, 4 weeks. I always follow up after 4 weeks. 2 weeks is not
a real reflection on how things look, because you get quite a lot of swelling which can persist longer than, say, 2 weeks. Risk of bruising, is that any different?
Well, because I use a cannula,
Yeah.
unless I hit a vessel when I'm going into with the introducer, virtually no bruising whatsoever.
Okay.
So let's
Dr.
just do
Rakus, can I ask you what is your feeling about how it compares differently to other products that you've used for lips in the past?
As I mentioned before, the main difference I find is
I'm going to go back in again
a lot
this
less
side.
swelling.
Yeah.
And as Lee mentioned, that the product looks
Just
good
pucker
after
for me.
3 to 4 weeks, less
Yes.
incidence of
Yeah.
Similar.
lumps for it.
Yeah. So I used some Princess Filler last night, and I actually found, in comparison to what Lee said, I found that the extrusion force was slightly less. I found it very easy to manipulate the product, and therefore, if you're kind of putting less pressure in, there's less side effects, such as even bruising and things like that. Our precious client base, they think you can put a needle into someone's face without bruising, and all of us know that, unfortunately, sometimes you can't. But I feel like it does reduce your risk of bruising as well, because the product just flows so easily. And is your preference always cannulas, Lee?
My preference in lips is always cannulas, and it's I suppose because I've done quite a lot of cadaver dissection courses, and I'm always concerned with the how anatomy is so variable, and then it's we've got the superior labial artery running through there, and I'm always concerned about hitting that and causing a problem, a complication.
Yeah.
So with cannulas, I think I can sleep easy at night.
Yeah.
Okay, so if I have the introducer again.
Oh, that looks lovely.
So if you can see that if my patient kisses now, we can still that she's got a little bit of a dip down here. So I'm just going to go along the top and support this here, because the upper part of her border here is fine. This is still a little bit uneven. So I'm going to go above now and just to support the top of the lip. And close.
Lee, was you actually going into the vermilion border, or was you going slightly below it?
I was going into it.
Right, okay. Dr. Golchin, can I ask you about...
Yes.
Can I ask you a couple of questions? Yeah, that'd be great. How do you think Princess helps with migration of product? Do you think
Plug up for me.
that you've noticed less migration?
Relax.
One of the main products that are used on the Princess range is the Volume Plus.
Yeah.
And for me, it's one of the best products that I've used because of the higher amount of hyaluronic acid. It's about 25 milligrams per mil. You get a definite more of a lifting capacity with it. But I haven't found migration an issue with Volume Plus. Certainly for volumization, it's does exactly what it says on the tin.
No, because I find that sometimes migration can be a result of technique. Unfortunately, in some practitioners who haven't got as much experience. But also, I think certain products do predispose to a little bit of migration as well. But certainly, when I've been using the Princess, I found virtually, absolutely no migration. I think the hyaluronic acid content is probably, higher than most.
I think the product is important, but also it's the area.
Yeah,
So if you're injecting around the orbital or periocular area, because you've got this sphincter action of the muscle, that constant motion is going to shift the product to different areas. So, for example, when you do tear trough, if you think about it, every time you smile, you're going to push the product up. So you have to have enough space to allow for that to happen. So what tends to happen is that, you see, if you follow the patients up post-tear trough, it always looks amazing on day one when you do it. But look at them 2-3 months later, and you see often the product is come down a little bit, or it's gone into the eyelid, or it's medialized or lateralized. So often the message really is for when you've got a sphincter action around the mouth, around the eyes, use less. So that is the key. So, and also choosing the product is really important as well. So you have to look at, depending on the patient. So if they need a lot more volume, so you have to use something that has that higher density to give you that volume. And then if they don't, you use something softer. So if it means that you use something like Princess Rich, for example, which is a very soft superficial filler for the skin, you could actually use that just treating the area superficially.
If you actually look at what Lee's doing, he's directly injected into the perioral region, and look how natural that looks, whereas you see so many people with this puffy face, where the filler's migrated up into this perioral area, and it looks terrible, it looks very false, whereas Lee is actually directly injected into the perioral area, and it looks so flat, not raised, there's no, inflammatory reaction, there's no swelling. And this is immediately as he's injecting. It looks fantastic.
Well, you can see this. I mean, what Lee is doing is, is injecting very, very slowly with the cannula. And that's another key important technique. The slower you do your injection, the better the result is going to be, less chance of complications. So you're going to get less bruising, less edema, and less likely to actually make a mistake. So you can never be slow enough when you inject. Problem is, in a busy clinic, we're always rushing to sort of get through it and go to the next patient. But Lee is demonstrating that, quite nicely. You can do my lips, Lee, later.
Okay, so we've done the oral commissures as well with the cannula. We've gone down onto lower lip just to give the ratio of the lips a bit more harmony. So just pucker again for me. Good. And relax. Good. Put a little bit more in.
Yeah.
Yeah. So no, he's using filler here. Okay. So we've got 4 products. We've got Princess Rich, which is like a mesotherapy product. It's very fine, made for very superficial wrinkles. Then we've got the filler product, which is actually mainly for the lip area, but we can use it in nasolabial folds, other areas as well. Then we've got Volume and Volume Plus. So actually last night, Mr. Gambin, he actually did my Volume Plus, didn't you, in my cheeks? Yeah, and you can see, I just literally did them like 7 o'clock last night, and absolutely no swelling, looks very natural. So it just depends on the area that you're treating. But with Volume and Volume Plus, you can put these products really anywhere.
You can. The product is quite versatile.
He had a little bit left. He put it into my chin.
Yeah.
Did a little bit. I got a new face this morning. He's the best.
Is it suitable for rhinoplasty? So for non-surgical rhino? Potentially yes, but you've got to be careful with any non-surgical rhino. The problem with injecting around the nose, because of the vasculature, it's very easy to cause a compromise. So the highest rate of necrosis, facial necrosis, is actually on the tip of the nose. So you've got to be really careful about using a product that is stronger and possibly thicker than some of the other products. So if you really if somebody has a very scooped nose and they're missing a lot of nasal bone, you could potentially do it, but you have to be really careful with that.
Oh, that's good.
I don't use the Thiocell. Thiocell Ultra Dip.
I don't think any of us are familiar with TSL at all. No. Are you?
No,
I'm sorry.
never heard of it. Yes. Was that the right answer, Paul? No, I haven't actually used TSL. I mainly use Juvederm, and I occasionally use Merck's range of products.
Okay, introduce her again.
But what I think also about the volume, so one syringe of volume, was it Volume Plus you used?
Volume Plus.
Yeah, so it did my entire face.
Got that.
So we did my cheeks, submental, a little bit, everywhere. So it goes a long way as well.
Yeah.
It must be because of the high.
I've always been a big fan of Voluma. Voluma for me was and still is the kind of the workhorse of all my injections. I started using Voluma when it actually came out about 10 years ago. But I find with Volume Plus, it gives me a couple of things that Voluma doesn't give me. Like I said, the lifting capacity is one. And something that I've noticed, and Lee has actually commented on this as well, and maybe because of the hyaluronic acid, the extra hyaluronic acid, the condition of the skin changes. So when you see your patients a few weeks later, skin appears to be more hydrated. Yeah. Initially, I just thought this was just one of those things, but Lee is saying exactly the same thing. So maybe there is something in this.
Yeah, absolutely. But also, obviously, the skin appears healthier, more hydrated, because obviously we all use Universe skincare as well. So I don't know if you're all familiar with this, but we're all big, massive advocates of Universe. In fact, it's the only skincare brand that I recommend in my clinic. And I think they just both really, really, work together, both with the high hyaluronic acid content in the fillers, as well as the Universe skincare products, having the medical grade active ingredients. They really complement each other very nicely. Yeah.
Saline.
Sorry, what do you use for teardrop, Princess? Do you use anything for teardrop?
Well, you can use the Princess filler and Rich, so you can use that. You can use that combination.
In my bag, at the back there's a Yeah, there.
Yeah.
Wipes.
Lee, this looks really lovely. How much of your syringe have you used now, Lee?
We've used one syringe, and we're on the second syringe, and we've got so one syringe, and we've got 4 left on that.
Okay.
So 0.4. So 1.6. Just gonna open your mouth for me. So perfect.
How long will it last?
So this will last 12 months.
Can you use it if the patient, for example, had a filler lips 6 months or 4 months earlier, use different brand? Can you use Princess the same area?
I think it's always have to be
Look, the difficulty nowadays is that, you know, we all have so many patients that have had fillers done elsewhere, and they come to you,
Kiss again.
and most of the time they have no idea what was
Okay,
injected.
smile.
In fact, they can hardly remember the name
Side,
of the last
side.
injector.
So,
Technically, there's
Have
no
a look
issues
in the
putting any
tea
hyaluronic
leaves.
acid over another hyaluronic
Okay.
acid.
big enough?
The problem is some HAs have a propensity for causing more problems than others. You know, with late onset hypersensitivity reactions, granulomas, nodules, and so on. The issue becomes you don't know what's actually
Yeah.
causing the problem. Was it the injection that you did, or was it the injection that somebody before you did 6 months ago? And that's the difficulty with it. So for me, it's always more of a, I suppose,
I think you should use a leave-in
Yeah.
interval, because I think the problem is
Yeah.
that I'm sure you're aware that there's a certain range of fillers that have been linked to some problems post-procedure. You know, up to 3-4 months even, you're getting problems even longer. So it's always good, in my practice, I think leave a good 6-month gap between fillers, because they'll always blame the person who was last, you know, treating them.
How many people in here, just for interest, use Princess?
Ah,
Okay.
gosh.
And good experiences? Okay, good. How many people use cannulas in the lips? Okay. Good.
Excellent.
I'm done.
excellent.
Can I just speak to the patient for a minute?
Sure.
Yeah. I'll give you a mirror to have a look.
Okay,
Is it better? How did that feel? Was it good? Oh, excellent. I was going to show you. You got a minute? Yeah? Okay, this one. Oh, okay. What do you think?
Yeah, lovely.
Yeah. Can I have a look?
Fantastic.
Oh my God, they're fabulous. Oh, they look so nice. Okay.
Yeah, that looks good.
Yeah, it looks good, doesn't it?
Very nice.
Do you know, Lee, the filler you've put around the perioral area
Yep.
has really helped to augment the lips. And this is something that I think is really important, because if you notice, there's virtually no swelling in that area.
And it's changed the distance as well.
Absolutely, it's
Yeah.
fantastic.
Mm.
It's given a real youthfulness
Yeah.
to the lip.
Okay. Good.
Very
Thank you.
nice.
Have you used Volume Plus, and do you recommend using Volume Plus for the lips?
I haven't personally used it yet. I think it might be
Volume
too.
Plus for lips, no.
Yeah.
Too thick.
Which one did you use?
This is filler.
This is filler.
So Princess
It's
filler.
called filler. It's not a very imaginative name, but maybe you can have a chat with Chroma. Yes.
You don't forget it. No.
Keep it simple.
Keep
Yeah.
it simple.
So for the Volume Plus, I would use it cheeks, and then your sort of jawline, chin, temples.
We're actually going to have a demonstration now by
Yeah.
Mr. Golchin, and he's going to show some mid-face volumization using mainly Volume Plus. Yeah?
Yes,
So I think we'll just prepare him for that.
absolutely. So Karen, can I have a just?
You can get down a little bit later. Stay there.
So this is Caroline, 62. Caroline has been living in Italy and Florida for 25 years. So even though she uses SPF, you can see there is a little bit of sun damage. We had a little chat early on. She hasn't really done a huge amount of cosmetic work before. She's had a little bit of toxins done. She had threads, is that correct?
Yeah, PDO threads.
PDO threads. And one session of Profilo, was it? But that's about it, is it?
Yep.
Have I missed anything?
No.
Okay, so let's just have a look and see if you can see. So there's an important family function coming on in 2 weeks' time. So Carolyn wants to look her best. So before the stage, I was having a chat, and she said, "You know what? I really don't like this. I'm getting a bit of jowling. It bothers me." Now this is kind of interesting because traditionally the only way to treat this was to do a facelift, or lower facelift would treat jowling. Nowadays we have machines, so we have radio frequency, we have ultrasound-based devices to do the tightening, or lasers. But can we do something with fillers to address this issue? So I said, okay, well let's see if we can do this. Generally, when you look, we do a quick assessment. There's a slight amount of temporal hollowing. There's a little bit of volume loss in the mid-face. Lateral cheek. Yeah, so let's just turn
Sorry,
you.
Mr. Golchin, can we just move this to the side because we can't actually see the side you're referring to?
Okay, so
Yeah?
let me come round this side.
That's perfect. Sorry to interrupt.
That's okay. Thank you for.
Yeah.
You know what it's like. I get carried away. So let's start again. A little bit of temporal hollowing. You can see the mid-face volume loss. When you look at the lateral cheek, it's a little bit flat. So you've all heard of that Uji curve. So we're kind of missing that nice S-shaped curve on the lateral side of the face. A little bit flat just in the preauricular space. And then lower face, you can see the angle of the mandible is going in a little bit, even though it's bulging here because the masseters are hypertrophied. They've come out a little bit. You're getting a little bit of jowling. We've got a deep nasolabial fold, deep smile lines. There is good news. It's coming. We've got our marionette, which is quite deep. Now, I'm actually really fun to go out with. So if I turn you to the side, and we look at the side profile, and if you look at the chin, you've got nice projection, but just look at the chin. Okay, you've got that roundness because one of the things that happens as we get older is the action of the mentalis muscle. The repeated contraction rolls up the chin, so the lower third of the face gets shorter. So when you come back again, so when you look at the face, if you divide it in vertically into 3 zones, you can see the hairline to the eyebrow. That distance has increased a little bit with a little bit of volume loss in the mid-brow section. If you look at the mid portion of the face, reasonably equal distance, but you can see the lower third of the face has actually shortened. And this happens to all of us as we hit the age of 40, 41. The angle of jaw tends to widen, so the jaw drops down lower. That widening causes a lot of the jowling. So it's not just the fat has just dropped, it's actually because of the change in the angle of the jaw. So there's a few things that are going on here. So what we're planning to do is to try and restore some of the volume in the mid-face, restore the volume in the lateral cheek, and we want to see if we can actually pull things back a little bit using a filler to basically improve the jowling and improve the smile lines and the marionette. We probably have to do a little bit of work around here as well in the nasolabial as well and the perioral, but that will be our last, because just like the cheek, when we normally start high up and work our way down, you want to create that lift from the top and bring it back down to the bottom. So that's the plan.
Brilliant.
Okay?
But you've got a nice jacket anyway.
You have an amazing jacket.
Yes, thank you.
No, it gets better. Okay, so what I like to do before my patient sits down, because I want to see the full effect of gravity, is to do some markings. So, and everybody uses different tools for this. You've seen people using various things on stage before. Has anybody seen one of these? I used to hate this in geometry. Still don't know what it's called, but anyway, I use it. So I find this quite easy to use. You can get your angles, you can get your distances. It doesn't have the same look as...
Some of the very clever tools I use in my Instagram videos. But
Correct. What do you use?
we use one of those scalable.
Yes. Yeah, the digital ones?
Yes.
Yeah,
But you're a bit older than me, so.
a little bit.
Not.
Thank you. I'll remember that next time I do your fillers. Okay. So let's look at the highest cheek point. So what I tend to do for most people, if you drop it down by about 3 centimeters or so in female, would be somewhere in this region. And you can actually see this happening. So if you look at the lateral cheek or mid-cheek groove, smile for me, you can see that that's where the actual point is. So this is going to be one of our first points.
Sorry, Mr. Golchin, what is this you're referring to? What is this point?
The highest cheek point. It's one you never see mentioned.
Okay.
But actually, it's if you look at the cheek...
From the lateral canthus down.
From the lateral canthus down, if you drop
Yeah.
a vertical line down, about 3 centimeters, and come out a little bit laterally.
But when she smiles, it actually dips in.
It dips in.
Yeah.
Yeah,
Just smile again, please, would you?
I know it's
I
difficult.
know you've got nothing to
You can
smile
see that
about
actually,
now.
yeah, but that actually dips in. So actually
Absolutely.
restoring this point is one of the key points to start.
Yeah.
Okay, so I said that we're going to improve on our lateral cheek, so we want to improve on our zygomatic arch. So again, you can actually measure this for the sake of making sure that you're perfectly symmetrical with the two sides. So if you, let's say, measure about 2.5 centimeters somewhere in this point, that would be where we're going to augment. I mentioned about the angle of jaw, so we're going to do a little bit of work around here. So I'm just marking where the angle is. Okay. And then I mentioned about the pre-auricular space here. So I'll put a little dot here as well. And then we mentioned that we might do some work here in the nasolabial fold and generally in this groove. Okay, that should be enough. Okay. Now, if we have time, we might do a little bit on the chin as well. Okay. All right. So I'm going to get you to lie back.
Kambiz, what would be your reason to select the Princess Plus over the Princess Volume?
Princess Volume Plus.
Sorry, can you repeat the
Princess Volume Plus over the Princess Volume.
Well, actually, the volume is quite good as well, and I do like using the volume. I tend to use volume when I'm a little bit more superficial. So it would be the equivalent of, for me, would be similar to, let's say, Volift or Juvederm 4.
Yep.
You get a nice lift with it, but not as much as Volume Plus.
I think, Lee, with the Volume Plus, it's really for folds.
If you could load another one.
Would you
for me as
agree,
well.
Mr. Golchin?
Say that again.
Just if you load another one, please.
It's folds rather than
Yep.
Not the cannula. I just want to use the needle first. No, leave that one with the cannula. I'll use that as well.
So, Mr. Golchin, I was saying that really with the Volume Plus, we're looking to try and lift folds rather than just
Correct.
lines, yeah.
Correct.
Sorry, how do you get the second reference point from the original point 2 centimeters?
Just eyeball it, really.
Is it from
It's
the
just on the zygomatic arch, so you just want to, you know. So it depends.
not from the tragus?
No,
No.
no.
So, Mr. Golchin, how many mils of filler are we sort of anticipating using?
I
for
would
this?
imagine probably about 2 mils per side should be a good starting point here. I think realistically we could go up to about 6 mils in total.
Probably not necessary.
Not necessary. I think 2 mils. That's what I intend to use per side.
I mean, that's pretty good, yeah.
Yeah. Well, I may regret saying that, but let's
I'm
see.
going to hold you to that, let's see.
Please don't.
I'll
Okay,
see how
so
many I can do on the other
we're
side.
going to make a start. So what I like to do is the old technique of squeezing, lifting, and inserting. Now, I'm right on the bone here. So do I need to aspirate? The answer is no. There is absolutely no blood vessel here that I'm going to hit.
And so you are using direct boluses?
Direct bolus.
As opposed to cannulas for... Is this your first injection point? Is this
This is my first injection point.
Okay.
I could use a cannula here as
Right,
well.
So why have you not?
I'm going to use a cannula later on, so I thought it would be interesting to see both different techniques. But
Okay. But why would you use... Is it because you just want the initial projection?
I want the initial projection.
Okay, fine. Okay.
So
Wow.
now with Volume Plus, initially when you put it in, it looks a little bit proud and a little bit prominent. And sometimes you look at it and go, oh, maybe not, I should have used...
Yeah.
It settles. It's quite a malleable product as well, so it settles quite nicely. And you can see immediately it's settling down. So a big smile for me again. Great, thank you.
So if you actually look at the nasolabial fold here, you can see just with one bolus of... How much was the bolus?
This was 0.2 cc of Volume
I
Plus.
mean, that's quite dramatic. If you remember, this right-sided nasal labial fold was quite... It was a fold. It was much more severe than the other side, yet it's lifted up quite considerably with 0.2 mils. I mean, I know Mr. Golchin is a fantastic injector, but it's got quite a lot to do with the product as well, I think.
We'll talk later. No. Yeah.
It's got a lot to do with Mr. Golchin, though, obviously.
Have you placed that underneath?
Sometimes too late. It's just too late. Okay, so this is actually quite interesting. So I'm just going to sit you up for a second, Caroline. This is 0.4 mils.
That's
Look at the
fantastic.
lift that you're getting compared to the other side. So let me actually get rid of the marking here so you can
Wow,
actually
that's
see
really nice.
the difference. So already you can see that, we're getting a nice lift. Look at what's happening under the eyes. So look at the support it's actually giving the lower eyelid on the left side. Okay?
And the marionettes.
And the marionettes.
It's actually lifted the entire lower face just from 2 injection points, was that?
2 injection points. So next I'm going to inject on the angle of jaw. So just injecting on the mandible. This is directly on the bone.
What about the facial artery? Any risk there?
Facial artery right on the bone, no.
Isn't that where it emerges?
Facial artery.
The facial artery is that it's on the anterior border of the masseter.
Yeah. It's not facial artery there.
Yeah. What are you injecting in now? 0. So you've done 2 with 0.2 mil.
0.2.
So we've got...
Another 0.2 here as well.
So we've got 0.4 left.
Correct.
That's brilliant.
Kambiz, do you use the ligament to lift on the zygomatic ligament?
The zygomatic ligament,
Is there?
yeah. So I have to say I'm a bit kind of I'm a non-believer in that theory that's going around the conferences. I think a lot of these theories are fine, but if you've ever done a facelift, you actually see it from a different perspective. So the idea that you put a little bit of filler and that supports the ligament, I'm not sure if that is actually the case. I think you do get an expansion of the tissues purely because of volume, and that's what actually helps. But I don't think it does anything to the ligament itself.
Interesting.
Obviously, we're all aware you're a surgeon.
Too late. Sometimes it's just too late. That's okay.
Right, so how long have you been using a princess filler for in your practice?
Well, in Knightsbridge, Dr. Rakus actually introduced me to the filler, and I have to the princess range, and I have to say I resisted it.
Why was that?
Because I was such a big fan of Juvederm.
Yeah.
Still am. Some of the products I really do love. Until I tried the Volume Plus, and that changed my perception of it. It is a great, great filler.
How long have you been using it now for?
A little over 3 months.
Oh. What's the main difference that you've seen compared to your Voluma?
Like I said, it's that increase in
Hyaluronic acid.
increase in the lifting capacity.
What you're saying before that there's a textural change as well to the skin?
Correct.
Yeah. No, this is something I've noticed a lot.
I'm not deep to the bone.
Sorry, can you say that again?
Yeah.
How deep in the preapical area? How deep if you go in?
Deep.
Are you touching bone?
There is very little bone here to touch at this point. So you basically have a lot of soft tissue space. So I'm going to sit you up again, and we're going to have a look again. This is like your workout today. So can we zoom out a little bit and head up? Now, just have a look at the jowl on this side compared to the other side.
That's really significant.
And that's with 1
mil?
mil.
Wow.
So that's with 1 mil of filler. This is what you can actually achieve.
Wow. No, that's really lovely. Very, very natural. If you see, there's very little swelling.
Very little swelling.
Absolutely. So what you're actually looking at is what you can see. So, you know, with some of the other fillers, you
I'll take
find
the
that they
Cannula,
look great and people
and you
walk
can lie
out and
back
they're really
again.
happy with the result. I know with Juvederm, with Volbella, you're feeling, oh, this is a really good result. And then
Actually,
you get the
before I
phone
take
call
that,
2
can I
weeks
take
later
another
saying,
Volume
oh,
Plus
the volume
with
has
this
gone
in?
now and
Yeah.
it's gone down so much and I didn't anticipate it and I think I need
Thank
a
you.
touch-up. So this is one problem you're really saving yourself. It's one conversation that you've not got time for. So with Princess, very, very few people are saying the volume's gone because actually there was very little swelling initially. You're going to save yourselves a whole load of conversations, I think.
Yeah. There's nothing more annoying than when a patient comes back to you with a complication that you have caused. It's always nice when somebody else has caused it because you sit there and shake your head and go,
I know.
that
Oh,
never
God.
happens to me.
I would never have done that.
No. Okay, so now we're going to go into the nasolabial for just a superior portion of it. So I'm going to do a deep injection right on the bone. Okay, it's not very deep here.
What's your maximum volume you would do here, Kambiz?
No more than 0.2 because again with a product like this what I don't want to do is to compress the facial artery.
Yeah.
Karen, do you know what the hyaluronic acid content is of this compared to Voluma, Allergan?
I do.
Yeah.
Give it
No,
Make us sweat first. So you don't know, rightly.
the hyaluronic acid. Yeah.
I work in sales, so I don't
Now, can I take a blue?
products.
Thank you.
25 milligrams in the Princess Volume Plus, and in Voluma there's 20 milligrams.
Correct. Now they're structured differently, and this is an important point.
Yep.
So maybe Lee, you can mention a little bit about that because
So the structures are is that in the Voluma you have a mixture of a high BDD cross-linking agent, and you have a mixture of short chains.
can I just,
With the Princess Plus, you have a smaller amount of BDDE, and you don't have no short chains, so it's all long chain hyaluronic acid.
So what does that mean then?
Well, what it means from my understanding is that if you've got a higher amount of BDDE in a hyaluronic acid, there is you change it from being neutral to being foreign. So the small amount of BDDE means that it's less likely to have any complications.
So I'm now injecting the nasolabial fold. I did a direct injection with a needle in the superior portion of it. And now just using a cannula just to sort of soften.
What gauge cannula do you use?
This is a 25 gauge cannula.
Okay.
Now I'm just turning the cannula down just so that I can get my marionette area. So using the same entry point, you can basically Try and cover as much area as you can. Again, no big volumes here, it's just little aliquots as I'm going along. Now, often what you have to do here is to do a little bit of subcision, because what you can see is that, I don't know if you can see this. So basically the muscle fibers are attached to the skin, pulling the skin down, creating that line. So if you do a little subcision and actually try and release those muscle fibers with your cannula, you can actually achieve a much better result using a lot less product. Sorry, Paul. But using a lot less product, which can often create that kind of a donut effect. So if you're anywhere where it's quite dynamic and you have a ligament or muscle attachment, you fill that up. Because of the muscle attachment, it pulls the filler out of the line and creates a donut effect. So you need to sort of try and avoid that. So it's useful.
You're doing a bit of subcision, and obviously that's going to cause us that kind of regenerative process as well as, supporting that area.
Yes, and potentially a little bit of bruising, which is.
Saw you with your marionette line.
Here again, not too deep. I was actually quite superficial because, as you could see, I was doing a little subcision there. So I'm going to use that again. Smile for me. That's great.
What do you think? What's the elastic properties like of the product? When you're in movement, when people are smiling, dynamic wrinkles. How do you feel that the product sits underneath the skin?
Is that a question to me or Lee?
To yourself, or to Lee?
To me. Well, when the patients return, when they walk into the room, it's always this kind of, I can never understand what the look is, but then you can sort of relate it to that it's the way that the product is integrated into the tissues, and they just get this really natural movement within the skin.
Yeah, I find it a really malleable, flexible product, and it moves with dynamic wrinkles. So you never look, you don't really get that frozen look. It's very soft.
Now, can I get a needle on that?
So how many mils are we up to now?
So we are getting close to our 2 mils. I still have another 0.2 cc on this that I can use, which I'm actually going to use on the chin.
Okay.
Because I am trying to address the jowls. So obviously I've pulled her back, but if I can extend the chin forward a little bit, that would actually help my jawline.
What's the maximum you'd put into the mental area in one bolus?
I've used 4 syringes in the one go. Rather than
That
doing
wasn't
it.
Princess, though, was it?
That wasn't Princess.
Obviously not. We wouldn't need 4
Life
bolus.
didn't exist before Princess.
We're telling this absolutely. Yeah, you don't need 4 mils anymore. You'll find a really small amount.
Yeah, I mean,
Spreads.
for me, it's interesting. When I'm sure you see this in conferences at the moment, there's a trend for using double-digit number of syringes. 12, 16, 20. Now, I don't know about your practices, but certainly in Knightsbridge, where we tend to get the poor people, they can't really afford double-digit syringes.
Can I just say, Mr. Golchin charges £950 a syringe. So they definitely can't there.
I didn't charge you.
So that's why we can't sell 22 syringes, because, The Saudis only come over in summer.
Can I just get you to sit up? So, now let's have a look. If you could zoom out, please, and let's have a look at the difference. So this is with 2 syringes of Volume Plus. So, problem area, I don't like my jowls. My son is getting married, I want to get rid of it.
Excellent.
This is with 2 syringes. I haven't used the machine to tighten, I haven't used threads, anything else. So you can actually achieve this. We've subtly contoured, and can I just say, what was it that you said to me? I don't want to look puffy and don't make me bloated looking.
Chipmunk.
This way you can't see it.
Yeah.
That's it, perfect.
There you go.
yeah.
So look at the jawline.
Wow. That is really excellent. Come on, guys, round of applause. Come on. Wow.
Now, this is by no means finished. I mean, you can definitely do more. I can put in more in the nasolabials. I think you can still do a little bit more in the midface. So, like I said, my estimate was 6 syringes in total. So I could use another 1 syringe here to really finish this off. Obviously, that doesn't include the lip area. So about 3 syringes per side. But actually, for the purpose of this, we wanted to show what you can achieve with 2 syringes, which is kind of a realistic number for anybody's practice. When somebody comes into you, you can say, look, we're going to use about 4 syringes. If they can't afford it on that one go, you can say, look, we're going to stage it. We'll do 2 syringes this time around. Come back to me in 3 to 4 weeks to review, and then we can do another session. So you can actually plan your treatment sessions.
Sorry,
Yes, go ahead.
augmentation. We normally inject midline.
Yeah.
I can see you went to the left more than midline.
Yes, I did.
So is this for
So it's not, no, that's not correct to say we normally inject in the midline. So midline injection is a point that if you want to increase the projection in the center of the chin. Here, if you actually noticed before, I actually marked it because there was a depression that you could see. Again, the muscle, the mentalis was pulling the skin in, creating a dimpling effect. So actually, I deliberately wanted to get rid of that, but also I wanted to extend the lateral part of the chin, which would actually help to get rid of the jowling.
So can you all see the elongation of the chin has really contributed to giving the very smooth contour
So if it
of the
turned
jawline?
this way.
Yeah?
Yeah.
I think it's fantastic. Would you consider, Mr. Golchin, putting a little bit of volume into the nasolabial fold here?
You can. I put a little bit of volume plus there, but you can actually put
Could you
volume.
overlay it with a little bit of volume?
Yes, you can.
Could you do it now?
I could,
Yeah?
of course.
Should we just like see? Because I'd love
Sure.
to see the finished one side.
Sure, let's do that. So
Brilliant.
can I have a volume, please, on a
Excellent.
cannula?
Sorry, so the way you treat the pre-jaw sulcus is by going angle mandible and the chin. Is this the way you treat it?
That's one way of doing it.
Yeah, so
It depends on how heavy the jowl is.
how heavy would you have said hers is? Like moderate?
No, this is not
Mild.
heavy. Yeah, mild.
So what is the other option if it is heavy?
For that, you have to come and do my course. No, it really depends on the rest of the face to see. Actually, I'm okay with that. It depends on how heavy the skin is and how much of a lift you need to actually achieve. So we're going to go back in here.
Why are you going quite low, aren't you, to get to the nasal?
Yes, I am. If I can find the entry point, that would be really good. The reason for that is I was trying to use the one point.
Okay.
I was trying to use the 1 point to cover my nasolabials, but also to cover the marionette as well.
Mm-hmm.
So avoiding excessive amount of trauma to the area. This is this volume you've given me or volume plus? No,
No, she
volume.
wanted yeah.
No.
Let's lucky check then. How do you feel the extrusion force compares to other products you use?
I think the extrusion force is actually similar. It's not
Similar.
any kind of a new cannula, please.
Yeah.
It's quite similar. I like the glass syringes. What I don't like about them, and it's problem with most of the manufacturers, is the markings on them.
Yeah, I agree.
Of course.
It is so difficult to actually
Can't
see,
them.
you know, and you often find that you're kind of twisting your neck to see, is this 0.4 or is
Yeah.
it 0.5? It's actually quite difficult to see. So with the volume, I can afford to be a little bit more superficial.
Is there a chance of getting any Tyndall effect with this Kambiz?
If you're too superficial, the answer is
Yeah.
yes, but I haven't actually come across that with Princess range yet. So
I mean, is the Tyndall effect related to hyaluronic acid density? What is it related to? Or is it just literally superficial depths?
It's the superficial
Yeah,
depth, yeah. If
yeah.
it's too superficial, then you get the light reflection.
Yeah.
Yeah. Although it's mainly particulate
Yeah.
that you see it more of, yeah.
there's, you know what, we've all heard that, but you see it with
Yeah.
you know, with the more homogeneous gels as well. It's not just particulate.
Okay.
It's the fact that it's a different substance. You're going to get the different reflection of light. So it's
Well, you do see it associated with certain brands
More
more than
so,
others.
correct.
You do.
correct. You see it more with, you know, with the more
Yeah.
particulate
Yeah.
gels. So we've just used another half a cc of volume. So could I sit you up again, Caroline, please?
Sorry.
And you can see that that has actually just softened it even more.
That's lovely.
So
Really nice. Can I ask you something? Do you mind? What skincare brand do you use?
Me? Oh,
Yeah?
I was
Oh, okay.
number 7.
Yeah.
So Nyla, what do you use? What kind of carry-on treatments would you do after your patients have had fillers?
Yeah.
Yeah.
What sort of products would you?
I only use Universe Skin. It's my number one choice because I think that the actual the substrate, the primer, is such a lovely, delicate product. It's most the way it's formulated. It's very close to the way our natural regenerative processes work. The active ingredients you choose, especially for that person. There's something like 1.8 million combinations of serums. Sorry, how many people are familiar with Universe Skincare? Dr. Rakus, what do you think of Universe Skincare?
Well, I don't think it's a coincidence that Schuco are distributing Universe Skin and Princess, because both of them are remarkable products. And actually, I think it's Chroma aligned with Universe Skin.
Nice flow.
And we're very excited about using it, and it's just such a wonderful product. New technology individually prescribed for each person, and it just totally knocks everything else out of the park, I think.
Yeah. Yeah, I couldn't agree with Dr. Rakus more.
I'm going to start.
It's
on
actually
the
the
other side.
only doctor-led product out there. I mean, I'm not sure, I'm going to tell you a little bit about it. So basically,
So
you
can
have
I
a
get
serum,
another Volume
which
Plus?
is a universal
Eye
serum,
needle.
That's the one that you
made with the latest nanotechnology.
Yeah, I'll start
It's
with the same one.
then mixed with various
There
other
is 0.2,
substrates.
perfect.
There is about
And can I
19
get
active
another,
ingredients, and you can actually make it individually
Yeah.
for the person. There's something like 1.8 million combinations
That's fine.
of serums, so every
Yeah.
single person will get a serum which is made uniquely to them.
You okay?
It's a really fantastic
Just relax.
product.
So what instruction you give, how to use it, how frequent, how often?
So, for example, me, I've got a little bit of pigmentation, so I use some arbutinine in there. I've also got a little bit of redness,
I'll take another one.
so I'll use rutin.
Take a gauze as well.
I also have got sensitive skin, so I put some aloe vera in there. So each product is it's a medical grade active ingredients, and you mix it for each person. So, for example,
Smile for me.
well, I don't know, Lee's obviously got beautiful skin. I'm trying to find somebody who's not, but you can, so depending on what the problem is of the person, Depends on what active ingredients you mix them. Only doctors can prescribe it.
And you can change it with the season as well.
Absolutely. So I generally give them a morning serum, a night serum. So obviously some of the ingredients like retinol I use at night, or some of the more stronger pigmentation like the kojic acid is one of my top ingredients that I use. I would make them an eye serum as well, because a lot of people have got the dark circles, so I'll give them 3 serums, an eye serum, morning serum, night serum. Through summer it changes, through winter it changes, so the serums last about 6 to 8 weeks. So, and the people absolutely love it because you're making it for them in your clinic. So you actually have to get your therapists all trained up and they're mixing it for them. And then you put their name on it and it's a personalised, individual product. They can reorder it and it's just a fantastic product.
Of course, they can't buy this on the high street or on the internet, and they've got to come
So,
back to you.
Something really important is there's no Amazon deals, there's no high street people trying to sell it to them. They have got to get that mixture back from you because it was issued on a prescription. Yeah.
Another volume plus.
There's only how many clinics are there that sell it?
No, on a Cannula.
Currently about a dozen, but
Yeah. There's some top clinics. I mean, I know Dr. Isho
Can
in
I
the
take
back
a full
there.
one?
He sells it. Dr. Rakus is probably one of the biggest sellers of it, and I think we're the #1 clinic for selling Universe skincare. Yeah, right. Oh, and Dr. Patel. He also sells it at 5 Clinic. No, it's a fantastic product, and you should speak to some of the reps because honestly, I cannot tell you. I mean, I use it. I've only ever used it, and honestly, it will give you the most perfect complexion. It will give you the most toned complexion. Your skin will be smooth, soft. It is just fantastic. They're also bringing out a range of cleansers, of new SPF products that are really revolutionary. Yeah. Just to let you all know that there's some glasses of champagne being served at the back shortly. Down on our booth, Schuco's booth. So you need to come down and join us for a glass of champagne. In fact, we'll get going now. We'll save Mr. Golchin a glass.
Thank you. Any
Is there
questions?
Any more questions?
Any more questions?
Shirley?
Near the nose where you're putting the bolus,
Yes,
is that on the periosteum?
correct. It's
Yeah.
on the bone.
Any vital structures there which need
Yeah, well, facial artery, part of it actually runs through that. So the nice thing is if you're on the bone, at most you've gone through it with your needle. So you've kind of skewered your artery with a needle, but you're not actually injecting directly into the artery. But again, you have to be careful not to put too much there because you can compress.
How much did you use?
0.2,
He used
0.2.
0.2, yeah. So you need to remember that this is volume, not volume plus. So volume plus, you need to be more sensitive with the,
Yeah.
you know, the amount of product you're putting in.
No, not at the moment.
So, time for any last questions? Otherwise, I'd very, very much like to thank Mr. Kambiz Golchin, Dr. Nyla, Lee Garrett, Dr. Rita, and of course Shirley Nichol for helping out with the nursing side, and all of you for being here. And please do come and join us for a glass of champagne down at Schuco. Thank you.